What's going on, guys? This is Travis Price with Turning 65, and I want to thank you for checking out this video where we take common questions about Medicare and private insurance and try to explain them in a way that makes it a little bit more crystal clear for you. Today is going to be a relatively large topic because it is one of the most confusing aspects of Medicare. And today we are talking about how to pick a Medicare Part D drug plan. A few things we're going to talk about today is the parts of a drug plan that you want to consider when you pick one, the stages of coverage, what type of tiers and what a tier is when it comes to drugs, and then we're going to do a short demonstration, hopefully, on how you look up your drugs to select a drug plan on Medicare.gov. So stick through the whole video because there's a lot of great information. Again, my name is Travis Price. I am a licensed insurance agent in the state of Michigan. You can find a lot of common questions about Medicare and private insurance answered at travisprice.com/turning65. And let's jump into this video. So before we start any conversation about a drug plan, if you are on Medicare Advantage or considering Medicare Advantage, do not go this alone. There is a big reason why. If you're on a Medicare Advantage plan and you try to select a standalone drug plan, in most instances, you are going to disenroll yourself from the Medicare Advantage program, meaning you will lose your Medicare or your medical coverage. I have had clients do this. They have decided they're going to go on their own. They select a drug plan. They lose their medical coverage. Do not do this without someone working with you. There are exceptions to this rule if you use a Medicare savings account plan, which is a high deductible Medicare Advantage plan. You can make a choice of drug plans. There are some other exceptions, but the most traditional Medicare Advantage plans that you're going to use, you cannot switch drug plans. You have to use their drug plan, or you don't get a drug plan if they don't offer one. If you select that plan. If you try to use a Part D plan or select a separate Part D plan, again, it will kick you off your Medicare Advantage plan. Talk to somebody about it first. So Medicare Part D, there's a lot of moving parts with Part D that you need to make considerations on in order to select a plan. So we're going to look at it as a bucket, and you want to make sure that you're filling your bucket with multiple considerations before you select a plan. And those major considerations are the drugs that you use, the pharmacy that you use, and the total cost associated with the plan. And we're going to go through each one of these in depth. So let's start off with drugs when you select your Part D plan. First thing we're going to talk about is a formulary. A formulary is simply a list of drugs that a Medicare Part D plan and company will cover and how they organize those drugs on how much you pay. Usually they'll list them from levels 1 to 4 or 5. Many times levels 1 or 2 either have low copays or no copays, so you don't pay anything out of pocket with some companies. However, each company is different, and so some might cover one with a zero copay only. Some might cover one or two with a zero copay. Some might cover 1, 2, or 3, and some might cover none. So it's important to evaluate the formulary to determine where your drugs fit, what level or tier level, and if they're covered, because Medicare Part D plans are not required to cover every single drug. They're required to cover a number of drugs at least per therapeutic condition. So let's say you have hypertension. They're only required to cover 2 drugs that offer relief under hypertension. Those might be generics or common name brand drugs, but your drug might not be covered. They may offer a generic or a different drug, and it's important that if you don't want to mess up your drugs, and a lot of people don't because they have relief with a certain drug and they might have a different reaction to a different drug, we want to make sure your drugs are in that company's formulary. So when we get to 4 and 5, which are your specialty drugs, you stop paying copay levels and you start paying coinsurance, which is a percentage of the total cost of the drug. Now, it's usually 25% that comes out of your pocket. The insurance company pays 75%, but these are incredibly rare drugs and well controlled. So it's not going to be your normal everyday hypertension or metformin or any common drugs. It's going to be drugs for very specific conditions. However, we want to make sure that we find out where your drug falls and make sure you have an idea on what level you're going to fall into. The next bucket or part of the bucket that you want to consider is your pharmacy. There's 2 levels of pharmacy. Preferred, which is a pharmacy that has a contract with the Part D provider. For example, if we're talking about SilverScript is heavily owned by Aetna, and Aetna is owned by CVS. So a preferred pharmacy for SilverScript would be CVS. You pay lower amounts when you use a preferred pharmacy. A standard pharmacy would still offer coverage, but you're going to pay more out of pocket for the same drugs. It's very important that we decide to use the pharmacy that you're interested in using versus just saying whatever pharmacy, unless you're flexible with your pharmacy. If you're interested or willing to go to Meyer versus CVS or Rite Aid versus CVS, if you're willing to make that switch, then it's not as much of a big deal. But if you're married to your pharmacy, if you like your pharmacy, then we want to make sure that it's a preferred pharmacy for the Part D plan. And finally, we want to evaluate total costs. What are total costs? Well, a lot of people look at Part D plans and they see a monthly premium. And I want to be very clear about this. If you're selecting a standalone Part D plan, that's a plan that is not attached to a Medicare Advantage plan, you're always going to have a premium. That premium may be relatively low, or it might be higher. There are companies that are only a few dollars a month, and then there's some companies that are tens or even hundreds of dollars per month. You don't want to look at the monthly premium as the deciding factor. You want to look at the total cost, which is a combination of the monthly premium and the amount that you would pay monthly for your prescriptions. So sometimes you might see a company that's charging, and this is an example, $15. You might have another company that's paying or charging $6.50 a month for coverage. The difference between these 2 plans The $15 plan may cost you $0 for your drugs, or maybe $10 for your drugs. The $650 plan may cost you $30 a month for your drugs. So if you're doing the math, you'll pay $15 to $25 for the $15 plan total each month, or $36 for the $6 plan per month. So it's important that you choose total cost over monthly premium. And now we're going to talk about the levels of coverage. And this tends to be really confusing for people, so I'm going to try and make it as easy as possible. We start from your deductible. That's the amount that you pay before the insurance offers any coverage. It starts on January 1st of each year and ends on December 31st. Not every plan pays a deductible, and not every person exits the deductible. If you do not have a deductible, you want to go to the initial coverage stage. So the initial coverage stage is everything that's paid except for premiums for your drugs by you and the insurance company minus your deductible. So once the insurance company starts paying, what they pay and you pay, that's initial coverage. That lasts until you pay $4,130. And if you have generics that are zero copay, those still count because your insurance company picks up the cost for those. So that counts into that $4,130 per year. Some people never exit the initial stage. If you have relatively low-cost drugs, you may not even touch the $4,130. So that's not going to be, this is not like a natural progression. Not every person is going to hit every single coverage level here, but it's important to know this is the amount for 2021 that you have an initial coverage, and even if you don't pay for your drugs, any cost incurred by the insurance company goes into the initial stage. So once you hit that $4,130 for 2021, you'll go into what's known as gap coverage. This was known as the donut hole for a really long time until 2020. You were paying into the gap coverage 100%. Again, not everyone enters this stage. For brand name drugs and covered generics, you're going to pay 25%. The insurance company is going to pay the balance of that prescription, and that lasts until you incur a total amount. This includes your deductible and what you pay and what the insurance company pays, up to $65.50. When you leave gap coverage, you go to catastrophic coverage, where you'll pay a fixed low copay for each drug. It's set by Medicare annually, and you'll stay in that stage until December 31st. So once you exit gap coverage and go into catastrophic coverage, you'll pay the fixed low monthly copay until you exit, or until it resets starting in January 1. All right, guys, as promised, we are going to go ahead and use the Medicare.gov plan compare, and you will see the link at the bottom of your screen. What we're going to do is use the new to Medicare option. That gives you the ability to check out your options and enroll in a plan online. And we'll start by selecting our county via zip code. I'm going to use Grand Traverse County 49686. And we are checking out, you have the option here to check out your original Medicare and drug plan, or using your Medicare Advantage plan. This is your all-in-one alternative to original Medicare, usually with the Part D. There's another video that you can check out. I'll leave a card that talks about the difference between using Original Medicare and Medicare Advantage for you to check out. But we're going to use Original Medicare right now and look through for our Part D drug plan. So you can see here in northern Michigan, specifically in Grand Traverse, your drug plan can range anywhere from $690 a month to $109.30 a month. Remember, that's only a portion of what you want to consider when you're trying to figure out which drug plan to use. So we're going to go ahead and look at the plans. So we're selecting our drug plan. We're selecting our county that's already there, and then it's going to ask you, do you use any of these programs? If you're not on SSI, that's disability, or any kind of Medicaid or Medicare savings plan, you select, I do not use any of these programs or get any help from any of these programs, and hit next. Now, I had already pre-filled some of these drugs out, but what you're going to do is you're going to say find a drug, type your drug in. Let's go ahead and put something like Ativan. Okay, you'll hit add drug. It's going to ask you if you want to use a generic. If you're using the generic, then you can add this generic. If you want to use the brand name, then select the brand name. We're going to add the generic. It's going to say 0.5 milligrams, 30 quantity, and just add to your drug list. Now I'm going to take this off because it's not really necessary to have here, because we have a number of drugs that we can kind of go through everything with here. So we're going to use metformin, hydrocodone, insulin, and a statin. So you hit done with using your drugs. And then here you're going to go through, it'll pull all of the pharmacies in your area. You're going to go through and find your pharmacy. And you can click as many of these as you want to use, up to 5. So if you want to check out different pricing at Meijer or Walgreens, or what plans would let you go to Meijer or Walgreens, or Costco, for example, you can do that. For ease of use, we're just going to select Walgreens. And then you'll hit done. Then it's going to tell you you have 29 prescription drug plans to use. Now, this is going to default in saying the lowest drug plus premium costs. So you can see here that they are going by this number right here, which is the yearly drug plan and premium cost. And it'll scroll down, the next cheapest one, the next cheapest one, next cheapest one. So in theory, what you want to do is try and get as close to the top as possible, because that's going to be the pharmacy that's in network for you, and also have the least expensive option annually for your drugs and your premium cost. And so on this screen, you're going to see a few things. You're going to see your monthly premium, which is the $13.60. You're going to see your yearly drug premium and yearly drug and premium costs, which is $7,665.44, and then you're going to see your annual deductible. Now, we talked earlier about not picking the cheapest plan under premium, and here's why. So $13.60 is the price of this plan, but if you scroll all the way down, you will find, so you'll see at the bottom here, you'll see Silver Script at $690 a month, but your out-of-pocket cost is going to be $54,242, and that is because this pharmacy is not in your network. So as you can see, it's very beneficial to you to use a plan that is in your network, even though it might not be the cheapest, and also to make sure it is not the cheapest overall if you're going to be paying a whole bunch out of pocket each month. But going back to our original plan, we're going to go ahead and enter into this Clear Spring Health Premium RX. Okay. So what you'll see here is your total monthly premium again, what the drug deductible is. Remember, if you have a drug deductible, you're going to pay that 100% out of pocket before the insurance will pay anything. Okay. So it kind of gives you the tier cost for you. You'll see your preferred generic is $1. Your generics are going to be $3. Your preferred brand is $40. And your non-preferred, which is your tier 4, tier 5, here is $35 and $25. Based on the tier, and that's during your initial drug phase, so that's after your deductible, but not before you hit the gap where you'll pay your 25% of costs. Then you meet the maximum of gap, and then under catastrophic coverage, you'll pay either $370 or 5%, whatever costs more for generics, and brand names will be $920, or 5%, whichever costs more for brand name drugs. So we're talking about pharmacy, it's standard and network, and then we're going to show you kind of the tiers, how it breaks down. So the reason why this drug is so, or your drug costs are so much, is because of insulin. It's just insulin costs are insane. But let's just go through that. So you're going to, before your deductible, you would pay $4,206.62. But remember, your deductible is going to be the $445. So you'll pay your $445, and then behind your deductible, you'll pay whatever is left over. They'll pay their portion, and then you'll pay your first portion. So you'll see for your first month, if you started in March, your deductible plus what you'll be expected to pay out of pocket is $551. And the reason why that is you're going to skip this initial period. It's going to pay its amount, but you're not even going to stay in that period because of your insulin cost. You'll go from deductible straight into the gap. And when you hit the gap, this will be your monthly amount, your estimated monthly amount. And you'll see as you go down here, you spend 5.5 months or close to 6 months in that gap. And then you'll max out the gap and go into your catastrophic coverage, which is the $370 or 5% for generics, or the $970 or 5%, which is the generics for all of your other medications. I want to say that the metformin isn't covered, and that's why you're paying the straight up $25.96 in this plan. The metformin isn't covered. So at the end, for the last 3 months, you'll pay the $243.69. After December, the plan rolls over and you start all over again. So that is how you figure out what your monthly cost is going to be. Now, there's something you need to also realize. Most people start shopping for a new drug plan around annual enrollment period, which is going to be from October 15th through December 7th. So if you come onto this screen before October 15th and you're trying to shop for the next year, it's not going to update yet. And so you're going to be seeing the current year, their cost and what's covered in the current year, not for the next January 1st. Secondly, these prices aren't always accurate, even if you go into after October 15th for the next year, because plans can change up until January 1. At that point, the plan is pretty much locked in. So these prices aren't always accurate. That's why it's really important during annual enrollment that you speak with someone, because these prices may not have updated yet. So that's pretty much everything concerning this portion. So I hope I've been able to clarify Medicare Part D for you. If you have more questions, please don't hesitate to reach out or leave a question below. I'll be more than happy to try and answer it for you. You can give me a call at 231-884-8161. Or you can check out travisprice.com/turning65 to check out some of the most common questions about Medicare and private insurance. Again, my name is Travis Price. Thank you so much for checking out this video, and have a great day.